We are here to talk about epidemics plaguing the United States at the present time, and in fact, global. It is certainly not a positive topic, but it's a critically important topic because it's happening, no matter how we look at it. We've got a remarkable panel of people. We have Barbara Ferrer, who is the director of the LA County Department of Public Health. We have Mindy Grossman, who is president and CEO of Weight Watchers, or WW, as it's now called. It's a new wrestling foundation also. And David Kessler, former commissioner of the FDA and professor at UCSF, and an author who has pushed many of these topics in his writings. So David, let's start with you. What keeps you up at night? If all of these issues, what keeps you up at night? What worries you that's going on today?
Each one of these deserves, a whole session. Let's just talk about one of them. Let's just talk about vaping. I lived firsthand going inside the tobacco industry back in the 90s. We did the investigation when the CEOs held up their hands and testified. We spent 15 years collectively, everybody, a great history, accomplishment of public health, getting cigarettes regulated. And when I was commissioner, the high school seniors, about 24% smoked daily. Right? Today it's 4%. Right? So you go, wow, we've changed the way kids and young people look at cigarettes. And then you see 24% that's been replaced by vaping. I had hoped public health community is split on e-cigarettes, or had been split. Right? My friend Stan Glantz at UCSF, e-cigarettes are the devil. I was never of that view. I had hoped that maybe there was a way to substitute, to in our lifetimes, to get cigarettes to basically become non-existent and find something that was safer. I was holding out for that hope. Now, maybe I would be wrong, right? But 400,000 people die a year of cigarettes. How many are dying from e-cigarettes? There's a net positive benefits. Is there a trade-off that we can move this country? And then something happened, right? When I wasn't necessarily winning that argument with my colleagues in the public health, they said, hey, still problems with e-cigarettes. And then this company, Juul, comes along and acquired, Philip Morris. And I will tell you, I think they have set back public health single-handedly on this issue. They basically have killed any ability to make progress on e-cigarettes. Right? Prior administration, this administration have been tepid at best. But the short-term mentality on the part of Juul and Philip Morris, right, by getting kids addicted to nicotine, has basically taken front and center, so any possible long-term deal that we could do on e-cigarettes is no longer viable. You're going to have to shut down Juul as we know it. With these kids, it's going to have to be dealt with, and some administration will have the courage to do it and step up to the plate. And then maybe after we put the genie back in the bottle, we can talk about public health. But they have messed it up single-handedly.
It's powerful, right? Nicotine in a developing brain, the carrier molecule to get nicotine in the lung, the effects on the inflammatory system, all of the above.
And they went ahead and they targeted kids, or did whatever they did.
Bubblegum, flavored
products.
Marketing. They could do it without anybody knowing at school.
I don't think you have to really wait for the federal government, though. In LA County, we've got a proposal on the table to ban flavored tobacco products. The FDA already did ban flavored tobacco products except for cigarettes, except for menthol. It's time for counties, municipalities step up, ban flavored tobacco products, including e-cigarettes. I mean, that's what's appealing to young people. Tobacco, smoking something that has a tobacco flavor, unappealing. Smoking something that's tutti frutti, that's sugar pop, that's grape flavored, much more appeal. And in fact, when you talk to young people, they don't think it's dangerous.
But nicotine's still a very effective drug. It affects alertness.
Absolutely.
Right? I mean, and the problem is that 12, 13-year-old who thinks they're going, just go back and look at the tobacco industry documents, right? Now that we could see them, they're online. What the industry knew is that 12, 13, 14-year-old who was experimenting, right? Who thought it was cool, who thought it was their friends, right? Became addicted by 16, 17, or 18, but they became addicted. They always thought they could stop until they tried to stop, and only afterwards did they learn that they were addictive. I mean, the efforts by LA, San Francisco, I mean, are heroic, but they happen when there's a failure of the federal government.
I totally agree. No disagreement on that.
I mean, I've had conversations, we did podcasts with the head of the National Cancer Institute and the former head of the FDA, and I asked both of them the same question, and they had the same exact answer as you. So certainly, this is a major public health epidemic we're going to have to address.
But the Obama, the rules were sitting at the White House for years. They never got moved, right? Scott, to his credit, Scott Gottlieb, right? They delayed the deeming rule to 2022. I mean, what's going on here?
Yeah. Obviously, it makes no sense. You look back at history that you were a part of, and you took an active stance, and it made an impact on public health. We need that stance again, no question about it. There needs to be a movement against these because of what it's doing to the brains of these kids. 100%. Mindy, obesity. Obviously, you're against it. And you're leading an organization that has, really put behavioral change ahead of anything else and developed a feedback loop so you can measure it in a very powerful way. Is it working?
Yes. So you asked what keeps you up at night. What keeps us up at night is we go to all of these conferences where people are talking about the growth of the wellness economy from 3.7 trillion to 4.2 trillion. Everybody's thinking of themselves as a wellness company, and we're getting unhealthier every day. And there's no evidence that with all that spend, we're seeing results. And the fact is that if something does not change, millennials will be the most obese generation in history. And my granddaughter, who's 2, will have a better chance of being obese and unhealthy than being healthy. So the reason I joined the company is this is a brand that's been transforming people's lives through the best efficacious weight loss program on the planet. And we felt we not only had the permission, we had the responsibility to be so much more than that in today's environment and give people a full ecosystem to allow them to have sustainable behavior change. So over the course of the last number of years, in addition to leading in nutrition and weight loss and our science-based programs around that, we've added the impact of fit points around activity, mindset and mindfulness, motivation, the inspiration of community, 24-hour coaching. So ostensibly building a complete ecosystem for livable, sustainable results. And the biggest issue most people have, we don't even use the word diet anymore. We don't dictate to people what they should weigh. We basically say, what does healthy mean to you, and how do we give you the support to be able to do that? And what we're seeing as a result is highest retention rate in the history of the company. I mean, we've said this year will be north of 10 months. I said I want to be talking about it in years because what you need to maintain sustainable healthy habits at 20 is different than 40, is different than 60.
So sustainable healthy habits is a very powerful, strong term. I mean, if you ask me what is health, I have no idea. And that's the dirty secret in our field is, yes, lean body mass is good. So when you have a metric of losing weight, when you have a metric of how many steps, do you actually follow disease or the absence of disease as one of the metrics?
So let me sit back for a second. Here's one of the problems we have today. You know, this room has incredible expertise. You know what the science is, and you know what's right, and you know what's wrong. The average consumer is so overwhelmed. You know, we have a chart that has about 40 things on one side and 40 things on the other that come out in social or editorial and then negate one another. Kale is good, kale is bad, gluten is good, gluten is bad. People are frozen. We actually call it the impotence of abundance, right? There's so much out there that people don't know what the truth is.
Everything goes back to sexual function, is what you're saying.
I guess so.
Yeah.
But the truth is that people want to know what's real, and they want a trusted voice and advisor. And that's what we're trying to provide. So everything we do is science-based, community-inspired, and technology and data-enabled. And yes, our programs, we have diabetes integration, and we have other things, but we're not saying we're a medical device. We're a complete behavior change ecosystem, and we partner with science, with medicine, with health, et cetera.
But I still don't know what to eat. Right? I mean, I have suits in every size. Right? But is it low carb? Is it low fat? Is it saturated fat? Is it insulin? Right?
So that's exactly the problem.
And only 12, I mean, if you look at it, only 12.5% of Americans, I mean, if you look at the guidelines, are metabolically healthy. Right? If you look at lipids and hypertension,
or metabolically within normal limits.
Within the
Yes.
guidelines. Only 12% of this country is, right? Tell me, what should I eat?
So if you look at the science behind the programs, we have one of the largest food databases in the world. Every single food is evaluated on calories, fats, sugars, nutrients, and very important, satiety. Does it fill you up? And they're ascribed a point value.
Right, but those aren't metrics of health. Those are metrics of potential
Well,
weight
they're
gain.
guidelines and metrics that go back to what is the healthy way of eating and nutrition. So there are about 200 zero-point foods, healthy you can eat, and then you're prescribed a point value. Do you want to lose weight? Do you want to maintain weight? Do you just want to eat healthier? And the combination of that is what gives people the tools sustainably and livable. That's the most important thing.
I get that. I mean, listen, I'm all for being lean body mass. I think it's powerful. And I think no matter what diet you're on, you pay attention to what you eat, which is fantastic. The point I think David was getting to is that we don't necessarily know what is healthy to eat. In almost every clinical trial, the Mediterranean diet has trumped others. I can't tell you whether to have kale or lettuce today or a tomato tomorrow. We have no metric in that. I don't know his insulin response to any food, and I can know the global response and treat everybody as one. But on a personalized basis, the technology will come, and it's probably right around the corner where you can measure your insulin response to XYZ and start to personalize things.
I think there's probably a second issue, though, which is disproportionately poor people, people of color, people who live in what we call either swamps, food swamps, or food deserts. People who live in areas where they neither have green space, or if they have green space, there are safety issues. Those people disproportionately are more likely than others to be obese. So one thing we could start at and agree at is there's some conditions and resources everybody needs to have in order to even think about eating healthy. And I don't think there's disagreement there. So that's a place to start. Is people do need access to affordable, healthy foods. When it's cheaper in your community to buy a sugary beverage than to buy water, and the water coming out of your pipe is brown, so you're forced to buying water, we have work to do about the conditions that people are living in that make it almost impossible for them to be focused on healthy weights.
And it's as important as anything we do in medicine.
Yeah, I agree.
I mean, diet has become, the power of diet is as powerful an intervention, and we didn't recognize it when we were, in medicine. Right? I mean, it's as important as anything, any cardiovascular cath lab or cardiac surgery. I mean, diet is as powerful when it comes to certainly cardiovascular disease, when it comes to stroke, when it comes to diabetes, and certainly in certain forms of cancer.
It's critically important, but the problem is there's no immediate feedback loop, and that's really difficult. I could do global feedback loops, what's your hemoglobin A1C, your average sugar over 90 days, but it's very hard with individual components of diet to actually know what's going on. And the other part of it is obviously being higher BMI is also a surrogate for being sedentary, and that's contributing to the health problems too, and they all lump together. And it's very difficult when we don't have ways of measuring these things.
You know, we have ways of measuring whether or not people have opportunities to do the kinds of things that would promote physical activity. So schools, you know, how many schools do people know you either went to them or your children are going to them? They don't have recess anymore. They don't have PE anymore. They've cut those programs out because they don't have money, they don't have facilities. So we have a whole bunch of children that all day long are in a school building with very little access to being physically active. The same thing for adults. Adults working longer, working inside more, working in isolated spaces more, very little opportunity for them to be physically active. So, you know, from my perspective, there are definite things we could be doing and investments we could be making right here, right now, that would help people be able to have access to the kinds of opportunities they need to be more physically active and to have a healthy diet. Anybody eat at a school cafeteria recently, breakfast or lunch? How is it possible that for our children most in need, we serve them the worst foods when they're in schools for breakfast and lunch still? With all that we know, with all the evidence that's out, why are kids getting sugary cereals for breakfast? Why are they getting sugar-laden drinks in a school environment? I mean, no, for me, there's no debate about why we have an obesity problem, because I think we structurally support an industry that allows people to eat unhealthy, and we make it really easy to eat unhealthy.
Well, to get normative behavior change, you need leadership. And one of the things that is sorely lacking in today's world is leadership. And obviously, the three of you are examples of leaders that are stepping up, but the voice is small, right? If you ask people today, who's the Surgeon General, nobody in the country knows who the Surgeon General is. If you ask them who's the Secretary of Health and Human Services, nobody knows who they are. And so we need that leadership to give that normative change, and it's going to be difficult to do it. So you run a public health organization out of Los Angeles, which many look at as the most diverse city in the country. I'm a professor at USC in a county hospital. There's a leprosy clinic every week. Leprosy in today's world. So obviously there's so much going on. How do you put a hierarchy? What worries you the most? And what are you kind of putting in your 1, 2, 3 position that keeps you up at night?
I think from a public health perspective, our biggest worry is around the inequities in health outcomes, and which is really speaks to the inequities in the distribution of the resources and opportunities people need to be healthy. So whether we're going to talk about issues related to healthy weight, whether we're going to talk about epidemics related to obesity, or infant mortality. I mean, how many people know that black babies in LA County today die at 4 times the rate of white babies? And that in fact, that death rate that black babies experience today in LA County is higher than it was for white babies 25 years ago. Here's a moral imperative. The color of your skin should not affect your chances of living your first year of life. And it is related to racism. It's not, people can sit there and look at the data. It's actually not caused by income. It's not caused by education levels. Highly educated black women, much more likely than white women who haven't even graduated from high school to have a poor birth outcome. Highly resourced black women, more likely than white women living in absolute poverty to have a poor birth outcome. Women who smoke and are white have better birth outcomes than black women who don't smoke at all. I mean, we have to really come to grips with what is the impact of inequities and social determinants of health on really allowing us to better understand why some people are much more likely to be sick and to die early in this country than other people. And that's going to require a very hard conversation about race and racism.
So have we done...
I love how you raise your hand.
So have we done all this to ourselves? So if you look at vaping,
right?
if you look at weight, if you look at these inequities, and this is about epidemics, these are all person-made epidemics? Is that what we've done? We've engineered all this stuff?
Is it the lack of governance, or is it the for-profit motive that's pushed it?
It's a human, the human endeavor has created these inequities, has created, this food environment has created these technologies that deliver nicotine, right? We've done these to ourselves.
And so whose job is it to stand up and say enough?
Well, look, I think what you're doing and what we're talking about democratization of access, is really critical. So what we're trying to do on our end, we created WW Good, and we've been doing health festivals, health and wellness festivals, kind of around the world. So we took over Santa Monica Pier, et cetera, because it's not only in lower income environments where you have issues in every environment and every community. So for people who came to learn healthy habits themselves, they unlocked the ability for someone in their community to get healthy food. We have to have a chain that is going to have that kind of impact as opposed to one person writing a check. The community has to be aware, they have to be educated, they have to be galvanized to action, and that's the only way it's going to happen.
I'm a big believer in partnerships. Like, when you ask, like, who's going to do this, I can't raise my hand and say, well, government's going to fix all this. They're not. But I do think partnerships are. I think there are places where you've seen transformative change, and it almost always happens because there's a lot of different folks that got involved. And there's, at the heart and soul of this is an enormous respect for people who are living in communities who experience the inequities, or who experience the stress, or experience the challenges. If we've talked with people who are living in communities where they're feeling disenfranchised, or they've been disinvested in their communities, they have really good ideas about what's going to fix it. So for me, the issue is partnerships. How do you get people who have good ideas with people who have resources, so that you're really realigning resources to really match the good ideas and to actually work together to make the changes as you best define them. And then, I think you have to take risks. You can't be scared to fail. Like what we're doing now is totally not working for so many people in so many different places. So, if we're going to really try to be innovative, if we're going to really try new things, some of those things are going to work and some of them aren't. And that can't be the fear that sort of lets us then try nothing new.
David, last word?
A lot of work to be done.
And optimistic in 2 years, something will happen?
You want an honest answer, or you want to stop the panel?
I want an honest answer.
There's a lot of work to be done. It's where you look at these issues, weight, inequities, the powerful nature of nicotine, these other drugs. We're going to be at this for a while.
But no one person, no one group is going to be able to do it on their own. And to your point, it has to be galvanizing partnerships across all areas of community to make it happen.
I appreciate it. All three of you, admirable and remarkable what you're doing. Thank you.